Hello, everybody. I am Dr. Sarah Wooten, and I am so pleased that you are watching this video. I am here today to talk about another beautiful, not gross at all subject. Today's video is all about blood in your cat's poop. What does it mean and what to do if you see it? So let's dive into this beautiful subject and learn everything we can so that we can help our cats. So if you're watching this video, chances are that you are actually dealing with this problem in your own life with your own cat, or you have dealt with this problem. If you are watching this just for informational purposes, well, I really applaud you actually, because this is pretty disgusting stuff right here. The thing is as gross as it is, understanding these concepts could actually save your cat's life in the future, and it may potentially save you a lot of money on vet bills too. So kudos to you for learning all about something that is something we don't typically talk about, which is cat poop. And I am making not one, not two, but 3 whole videos surrounding cat poop and pooping and all of that. So I really appreciate you sticking with me on these 3 topics. And I hope by the time you're done, you will know so much that you will be able to not only help your cat, but maybe you can help a friend's cat as well, right? So let's define a couple of terms before we get into this particular subject, okay? So I'm going to give you some medical terms, right? You're going to go and you're going to impress all your friends with these. So the first term I want to share with you is something called hematochezia. Hematochezia, hematochezia. And that is a medical term that veterinarians use to describe bright red blood in or on feces coming from the colon, rectum, or anus. So the colon is the furthest part of your gastrointestinal system from your mouth, right? And it is closest to the other end. And if there is a problem in this part of the gastrointestinal system, you will see hematochezia because the blood has not had a chance to be digested yet. Make sense? In contrast, there is also Melena. Melena. No, it is not a beautiful woman's name. It is the description of black, tarry feces. Ugh, gross. It looks like coffee grounds. And what it is digested blood. I told you this is a tough subject to tackle. And so when you see this, this means that there is blood coming from an upper portion of the gastrointestinal tract, such as the esophagus, which is the tube that connects the mouth to the stomach, or the small intestine. But it can also come from the mouth or the respiratory tract if that's the source of the bleeding and the cat is swallowing that material. Melena is more common in dogs than in cats, but it can happen. One cause of melena is coagulation problems with blood clotting, where a pet can't clot their blood, and that's usually due to accidentally eating rat bait. And it can cause actually both melena and hematochezia, so both the digested blood and the bright red blood as well. Blood. Okay, so let's talk about what causes these things, right? So let's talk about hematochezia first. Remember, hematochezia is the bright red blood. So anything, and I mean anything, that irritates the colon, the rectum, or the anus, or the anal glands, which are the 2 scent glands that are located at the 4 o'clock and the 8 o'clock position of your cat's anus. Anything that causes these body parts to bleed can cause hematochezia. It's important to realize that hematochezia can not only be caused by problems in those body parts, but it can be caused by conditions that affect the whole colon, all of it, or the whole rectum, or by discrete focal little conditions, like, for example, a bleeding tumor in the colon. These cats who have hematochezia due to a bleeding polyp or tumor or something going on in their colon or rectum, they often don't have any other signs. They may not even have diarrhea. They may have a totally normal stool, but it just has blood on the surface of it, right? But otherwise, they're acting happy and healthy. If they have problems with their anal glands, they may be over grooming back there. They may have an odor coming from back there. They may be scooting their butt. They may look really red and inflamed, or they may even have discharge draining from an abscess back there. So those are some of the things that cause hematochezia. Now let's talk about melena. Melena, remember, this is the digested blood that's coming from somewhere higher up in the gastrointestinal system or the mouth or the respiratory system. What can cause melena outside the gastrointestinal tract and what can cause inside? So let's go outside first, right? So first, you could have respiratory causes, believe it or not. So if they are sneezing blood, or they have a bloody nose, or they're coughing up blood, or they have difficulty breathing, are often the signs that the melena could be coming from there. And what happens is they'll cough something up and then they'll swallow it, cough it up and swallow it. Dental disease, believe it or not, chronically bleeding gums, that can also cause melena. Clotting disorders, usually due to accidentally eating rat bait or eating a dead rat or mouse or rodent that died from eating rat bait. Sometimes the only sign is the melena, and maybe you find something that they've been chewing on, like a dead mouse. And if a dead mouse or any prey that they're eating ever has colored granules inside of the stomach, so sometimes they bring it to you all half chewed. If you see anything that looks green or pink and is granular, that's rat bait, and you need to call your vet right away. Cats with melena due to bleeding disorders, they could often have abnormal bruising. You usually will see it on their abdomen, of all places, because there's less hair there. They often have pale gums. They can have bloody urine, and they can just be really weak. They can also breathe really quickly if they've lost a lot of blood. So let's talk about causes inside the gastrointestinal tract. So any bleeding in the esophagus, so the tube that connects the mouth to the stomach, any bleeding in the stomach, any intestinal ulcers or erosions that bleed. Those are all common causes of melena. Melena is the poop when it looks like coffee grounds, okay? Lots of things that can cause these erosions or these ulcers, including, but not limited to, parasites, inflammatory bowel disease, polyps, bacterial infections, eating something that they shouldn't have, and cancer. In addition, some drugs like non-steroidal anti-inflammatories. Those are your things like your carprofen in dogs. In cats, it would be meloxicam is a common one. Steroids. Steroids can also cause melena. They can all cause both non-steroidal anti-inflammatories, and steroids can both cause ulcers in the stomach and intestines. Ulcers can also be caused by kidney failure, liver failure, pancreatitis, Addison's disease. There's a lot of things that can cause ulcers in the intestinal tract of a cat. So if you notice that your cat has either hematochezia, which is the bright red blood, or melena, which is the coffee grounds, digested blood in their poop, you are going to want to call your vet right away. Think about it like a check engine light. These signs are an indication that something is not right under your cat's hood, and it's time to talk to a mechanic. I mean, a veterinarian, right? So talk to your vet. And if you take your cat in, your veterinarian will get a history from you. They will conduct a complete physical exam. They will likely do a rectal exam for cats that are suffering from hematochezia. And they're going to want to run some tests, some lab work, some blood work, maybe a urinalysis, maybe radiographs, which you often call x-rays, kind of the standard tests. And if they suspect that there's a clotting abnormality, if they think that your cat might have eaten rat bait or has some other problem clotting, they will want to run a blood clotting panel. If they suspect ulcers, strictures, or cancer, they may want to sedate your cat and scope the insides of the intestines. So if they think it's a bacterial infection or parasites, they're going to want to do some studies on the poop, right? It kind of depends on what your vet thinks is the problem. Furthermore, along those same lines, the treatment of both Melena and Hematochezia depends on the cause, right? Whether it's a stomach ulcer or kidney failure or a bacterial infection or intestinal parasites, the treatment is very different for each one of those. So GI ulcers, if those are suspected, your vet will most likely put your cat on a low-fat, easy-to-digest food and prescribe medications that protect and heal the gut. If your cat has lost enough blood to be life-threatening, a blood transfusion may be warranted. It's very important in all of this to not wait and see if you are seeing blood in your cat's stool. Because while some causes are fairly benign and pretty easy to treat, some conditions are severely life-threatening. So now you know a lot of information. You know how to tell the difference between Melena and Hematochezia. You know that Melena means that there's blood coming from somewhere further up in the gastrointestinal system. And you know that Hematochezia means that something's wrong further downstream. And now that you know those things, you can be able to help your cat earlier in case they ever run into a problem. So hopefully this information has been helpful and will help you to take better care of your cat and recognize that there's problems sooner. If this has been helpful to you, please let me know in the comment section below. And don't forget, I am not doing just this video on cat poop. I'm doing 2 other videos as well. So if you would like to hang out with me more and learn more about these topics or any other feline health topics, please hit subscribe. And I will be back soon with more videos and information for you. Thank you so much for watching. Have a beautiful day.